We are at the high end of overdoses and deaths caused by fentanyl and heroin. And it's increased this year, so that we have more this year already than we had last year. Last count that I had was 38 overdose deaths. And of those 38, I believe at least 34 were fentanyl-related.
In Ulster County, we have increased our opioid overdose. Our fatality rate has increased 177% from last year. So personally, I've lost 4 people in the last 3 months. Everybody under 30 years old.
And correct me if I'm wrong, but Ulster County and Greene County in New York State have the highest rates of opioid-related overdoses and deaths. Is that true?
That is true.
Why specifically these counties in our state?
I don't think we have enough resources. And in my experience, I think that we need more mental health care and definitely more substance use disorder care as well. So we're a mindfulness-based center, and there's a system called mindfulness-based addiction recovery, MBAR. So that's one of our core teachings. So what mindfulness does is it helps you to become aware of what you're feeling in your body. It helps you to become aware of your thoughts. We are a harm reduction-based center. So I will have people that come in and I know they're still active, and maybe they stop for 1 or 2 days or 3 days, and they say, "Can I go to a yoga class?" And I was like, "Of course." Can I go to a meeting? It's like, "Yeah, absolutely." Can I go to meditation? And it takes patience. But I've seen people over 6 months. One day they come in and they're like, "I can't live like this anymore."
I think it's because we're rural. I think it's because we're an hour and 20 minutes from New York City, and the biggest issue that's facing us is the pandemic. I think that plays a huge role in the uptick. We're looking to surpass 2018 numbers, and that's sad.
There's a major spike at the beginning of COVID in April. Overall trending high compared to last year, with the exception of October, which was attributed to the major distribution of deadly fentanyl, which caused a terrible surge in opioid fatalities. We're obviously quickly approaching our worst numbers from 2018.
It's a unique time, and we haven't seen anything like this in over 100 years. And the pandemic, not working, being at home, people that have depression, people that don't have enough money to put food on the table, causes depression, and there's an underlying mental health condition to the entire aspect, and it doesn't help when we have a pandemic on top of it.
This week, we surpassed 11 million cases of COVID and nearly 250,000 deaths. To put that into perspective, that means almost every American knows someone who has had the virus, and 1 in 3 Americans knows someone who has died from it. New Yorkers are feeling isolated and are under immense amounts of stress. Those are extremely difficult conditions for anyone, but for those who suffer from addiction, they can be deadly. Advocates, including the National Council on Behavioral Health, have called for the allocation of nearly $40 billion in emergency funds for providers of mental health and addiction treatment services. As the need for help rises, not only are these organizations getting pushed to the brink, but the in-person meetings where many people find the support they need can't convene.
One of the first things they teach you in any type of recovery is try not to isolate, right? And then, we have this pandemic and it's like, you have to isolate. I mean, I saw people return to use that hadn't used in 20 years, 25 years. I think the combination of the isolation, alienation, fear, anxiety, combined with having this super powerful drug, fentanyl, on the street, I think those two things combined kind of brought it to a perfect storm, unfortunately.
And fentanyl, I think the county executive made the right decision to call it a health emergency, because it is. And it's so scary that drugs that nobody knows how powerful they are being put in a plastic bag and distributed to people. Usually fentanyl is combined with heroin, can be combined with other drugs, but heroin is usually where we find it. And the danger is that fentanyl is actually less expensive than heroin. So when people cut the drugs, they add fentanyl, which is 50 to 100 times more powerful than the heroin. And nobody's measuring these in fine ways, so that the measurements are inaccurate and dangerous. And then depending on how much is added to any particular bag, that makes a Russian roulette kind of concept, where one bag might be deadly, the next bag might be normal, at least normal in terms of taking a heroin and fentanyl-laced drug. Drug traffickers are coming here from New Jersey and from New York City, and they're bringing up sometimes just straight fentanyl, sometimes mixed with heroin. And so our effort with the county sheriff's department and all law enforcement is to try and stop that from happening.
Here in this office, we have a drug task force called Urgent. It's the Ulster County Regional Gun Enforcement Narcotics Team. And there's been an uptick in arrests, almost double from last year, on dealers, people that have been dealing heroin, in particular fentanyl and opioids.
So we've now started, we just did this for the first time in this county ever. We are prosecuting somebody who is a drug trafficker who caused the death of somebody with manslaughter in the second degree. And so that is one, because we take it very, very seriously. You've caused the death of somebody recklessly, and you knew this drug was dangerous, and you knew this drug was potentially killing people, and you still kept dealing it. So when we have those kinds of facts, we will prosecute it to the highest level we can. And so that's a statement we're making. On the one side, we want people with addiction to get treatment. On the other side, we want the drug traffickers, especially those who are preying on these poor people with addiction, to know how seriously we're going to take it here in Ulster County.
Law enforcement, the different agencies, the City of Kingston Police Department, they arrest someone and they believe that this individual is selling because he's a user, we try and get them help. So it's a unique team. It's a culture change for law enforcement to do this. And the reason why it's so important to me is because that stigma that the family faces, and it affects this particular opioid epidemic, affects everyone, rich, poor, law enforcement, or otherwise. And I remember the crack epidemic of the 1980s and how it affected communities like mine. And so if you look at the way we've changed the way we treated people back then and how we treat them now, it's completely different. And law enforcement had to change, and we had to build that community relationship. We can't help people if they don't tell us what's going on.
Unfortunately, I mean, arresting drug dealers is important, but unfortunately that we're not getting to the core. And the problem is, I heard somebody say this years ago in a forum, and it was somebody who was active, and he said, you could arrest all the drug dealers in Ulster County, and if there's still a need, more will appear.
In 2018, Ulster County was the second highest overdose county per capita in the state of New York. I got elected in the end of 2018, and I immediately wrote out a program called Oracle in 2019. Oracle stands for Opioid Response as County Law Enforcement, and it's a four-phase program. Phase one, we actually got a trailer, which I can show you outside, that is a mock home. It was a education awareness trailer, and most people didn't know that their loved ones were addicted unless they walked into their bedroom, if they're living in their home. And so we showed them what to look for, and we did Narcan training, and then we gave them phone numbers to call.
What makes our program a bit different is, first, we're trying to get rid of the stigma. If you have an overdose, you have someone suffering from it, call 911. We're not here to arrest you, we're here to help you.
For me, it's personal. How hard it was for me and my family, and looking at the community and seeing how many other people are suffering and dying. Just learning more about it every day. We come out, and when we do help people, the reward is you can't even put a number on it.
Phase three is the medical assistant treatment program, and we started part one of that back in September, where if you fell off your prescription, we're going to allow you, we're going to give you that Suboxone or methadone here at the jail. The next phase of that's going to start at the end of this year is if you come in to the jail and you have an issue with opioids, we're going to give you a program. It's interesting. The majority of the folks that I have seen coming through the Oracle program are not necessarily minorities or people of color. I find that fascinating. I think it has something to do with the trust that communities like mine just don't have, that trust with the system. And so I'm trying to build that trust with them. It's an epidemic that seems to be focused on a certain age group from their 20s to their mid-30s, and it's also mainly Caucasian. I mean, I know that individuals in our community have the same problems, but that lack of trust with, with getting help is something that I'm working on.
The opioid epidemic destroys any community. It's a problem that transcends, social divides, genders, and races and income. It doesn't discriminate. And that's what is so concerning, that it doesn't matter what kind of community you really live in. You need to be paying attention to what's happening around you.
That people who are addicted to substances and to process addictions and whatever it might be, I mean, these are our brothers, our sisters, our mothers, our fathers, our lovers, our husbands, wives, and society has a responsibility to stop pushing people aside, because that shame and guilt, like even we have the isolation of the pandemic, but the isolation of feeling like an outsider keeps people in this cycle of suffering. Yeah, so I think the more that we can learn to understand and accept, people who are afflicted with addiction, the more we will be able to reverse, the epidemic that is happening. Because when people feel accepted and they feel that they are trusted and they are loved, and there's true compassion, they can really start to heal.
what would you say to someone who is struggling right now and seeking help in the community?
First of all, I would want them to know that so many people they don't even know care about them, that they're not alone, and addiction and substance use disorders is an equal opportunity disorder, right? It cuts across. We really don't want people to feel too ashamed to reach out for help. I'm somebody myself in long-term recovery, not from an opioid use disorder, but from a substance use disorder. And so, this issue is personal to me on lots of levels. I've lost family members to opioid overdose. I've lost family members to addiction. I just got lucky in my intervention, and know how hard it can be. So I would really encourage them to reach out, and that there's lots of different ways. There's lots of different paths to recovery. It's not what it once was. We're working as hard as we can to get kits into the hands of as many people as possible. And our efforts are working. And that's what we're seeing on a county level. There's an increase in overdoses, but the percentage of survival is greater, right? So that, we're meeting the challenge, and it's paying off.
I think the collaborative nature of our approach to the opioid problem is significant. That here we have the Sheriff's Department is doing great things with their Oracle program. We are partnering with them in that effort. We're working with the Health Department also. The Ulster County Opioid Task Force is all working on it. Samadhi is right over here about 5 blocks away, and we have a relationship with Samadhi. So it's really an all-hands-on-deck approach where the entire county's effort, both through the government and through private organizations, are all keyed up on trying to stop this disaster of opioid addiction.
We have multiple pieces in an orchestra, but you don't have a conductor in this fight. And that's what we're trying to do. We're trying to conduct it so we're all heading in the right direction and getting people help and arresting those drug dealers that are making money, pushing poison to our community. So I think it's going to get better. We're going to take 2 steps back before we take a step forward because there's a pandemic. But I do see a light at the end of the tunnel. I really do.